The programs of Good Shepherd Institute help navigate the many changes and challenges in the current healthcare environment and offer opportunities to explore new areas in the fields of aging, dying, death, grief, and other life transitions.
Bert was 57 and I was 52, and we lived a very full life. Never considered end of life. Why should we think of it? It just wasn't in our picture.
My husband, Livio, needed the help when he was diagnosed with cancer.
My family found Good Shepherd when my mom was in rehab, and we were trying to figure out what came next.
When Bert was diagnosed, it never occurred to me or him that this was part of end of life. I was dealing with the situation as a step in how we live. And now, looking back at that, I'm saying, wow, everything I read says that end of life will come sooner. Why didn't someone tell me that? And I would have prepared financially. We would have put many things into place in terms of our house and my security, insurances, that did not happen.
The end of someone's life, the final phase of someone's life is an important and significant part of their life. It's a part of their life to be lived. It's a part of their life where they can expect to be comfortable, and they can expect to find meaning in that part of their life.
Good Shepherd's mission is to provide end-of-life care to terminally ill patients, but also to provide care and advice and consoling for the family of the individuals and the loved ones.
Good Shepherd Institute helps make that mission a reality by bringing topics into the community that were traditionally taboo and helping people to talk about things that they are not used to talking about.
The Good Shepherd Institute starts with normalizing these conversations by really helping provide caregivers the education that they need to feel comfortable about having the conversation, providing resources to patients and families so that they can self-educate. And I think ideally, through public awareness, the Good Shepherd Institute puts itself out there as a venue to start having the conversation in a safe environment.
The programs of Good Shepherd Institute focus on community education events, resource library, media outreach, education of the healthcare community, research.
I feel fortunate to have a resource such as Good Shepherd very close in this community, because we'll all face death eventually, either our own death or the death of a loved one. And knowing that Good Shepherd is out there to turn to in your time of need is an invaluable resource.
Education about hospice and actually about end-of-life care in general is terribly important. We find people are often underprepared to face the challenges that arise when they or someone that they love is dying. There are many decisions to be made. There are many stresses placed on people. There's no doubt that by educating people in advance, we can make the whole experience better for everybody.
Good Shepherd really helped us navigate that path of all the decisions that had to be made during that time period, the medical, the emotional, psychological, you name it, they helped.
They educated me. The Good Shepherd tried to show me the correct way of doing it.
The long-term impact of the Good Shepherd Institute is to promote a healthier dialogue, a healthier community response to the way that we approach and think about end-of-life issues.
We need to talk about end of life in order to promote quality of life at end of life. I think that by not talking about end of life in advance, we don't have the opportunity to guide, direct, and really be attentive to a very important stage of growth and development.
We know that if people receive the kind of help and education that the Institute can offer, that they will feel better prepared, and as a result, the dying process will prove less of an ordeal for them.
I am exceedingly proud of the impact that the Institute is having and will continue to have.
The team of people from Good Shepherd, everybody was very nice and very kind and ready to smile. They were like brothers, sisters. They tried so hard to help, and they succeeded. They did help. And in our case, nobody could have done better.